Welcome back to the big picture. My guest is Dr. Todd Shatkin. Now, you've done other things besides the testing. You started to make hand sanitizer and masks.
So Phil, you know that I own Shatkin First, and we're aside from being a practicing dentist, we own a dental implant company, and we sell implants and related products to thousands of dentists around the country. And so this is a little bit of a downtime for both my practice as well as for our company that sells to dentists around the country, because the majority of dental offices are either closed or working on a limited capacity, treating just emergency patients. And so in an effort for our company to stay afloat, but also to employ the many wonderful employees I have here in Western New York and to support them and their families, I wanted to come up with a way to help them and also help the community at the same time. So we are supplying hand sanitizer, liquid, as well as the N95 masks, as well as surgical masks, gowns, face shields, goggles, pretty much everything head to toe that somebody would need to be protected if they're a healthcare worker, health professional worker. And we've been doing this now for the past month or so, and we've been supplying dozens of nursing homes around the country, dental offices, medical offices, small hospitals. We really were touched by the Buffalo public school system. We were contacted, and even though the schools are closed, they're still serving lunches to the students to keep them fed in the city of Buffalo. And they were in a panic because they didn't have any masks or gloves they were reusing masks and gloves, can you imagine, for several days. And so my brother and I donated what we could to the Buffalo public schools to try to help them to have masks. We also donated some to Damon College. We've done some other donations to different organizations around the country to try to help so they can continue to. The most important thing is to feed our children. You know, we have to keep that going. Even when I drove through the Wendy's drive-through, I noticed the girls inside and that were working there didn't have any masks. I handed them a box of masks. I said, "You should be wearing these." So you know, we got to help our community.
Well, now going forward, you know, obviously we all are waiting for the time that this is going to return to normal.
Yeah.
When that comes, how is this going to change what you do going forward in terms of your practice? What's going to be different?
Well, I think that looking forward that we're going to have to implement some changes in our practice, and that's one of the things is this protocol that I put forth. Hopefully we won't have to do that forever, but it's something to get us through this time frame, whether it's a month, 3 months, 6 months, we don't know exactly. But after that, I think that, you know, when I was in dental school I graduated in 1989 from the University of Pacific School of Dentistry in San Francisco, and that was right during the AIDS epidemic. And you know, San Francisco was the heart of the AIDS epidemic, you know, the center of the biggest problem, the hub. And when I started school is when that all started, and they implemented what's called universal precautions for dentists and for healthcare workers. That meant wearing a mask, gloves, eye protection, and the like. Now we're in a different kind of a situation with this pandemic, which is different than AIDS. We didn't know in the beginning whether AIDS was transmitted through saliva, through air, like a virus, but we found out later that it was different. It had to be done through blood or semen, right? Now this pandemic we know is transmitted through air, through the mouths, through aerosol, and from coughing and whatnot. So we're going to have a whole nother regimen for dental offices and other medical providers. I think it's going to be necessary to wear these N95 masks. I think it's going to be necessary to wear gowns and caps and more protection when you're working on patients, especially when you're doing invasive procedures like surgery. And so Shatkin First made the decision to open up a new division of our company, and we're calling it Pure Environments. And what Pure Environments by Shatkin First is, we're going to be helping supply these PPE for these dental offices. We're also going to be supplying a specialized air filtration system that we have the first one in the country in our 2 operating rooms here in our facility. We have the most advanced air filtration system in the world. It comes from Sweden, and it's accompanied by Avidicare. They make it. It's called the Opergon system, and we have become the U.S. distributors of this system. We're going to be offering this to medical and dental professionals alike, as well as hospitals. And what this does is it filters 99.9% of the air particles in the air down to 0.1% particle size, very, very small particle size. And it also has a positive pressure system so that it pushes away the bacteria from over the patient and pushes it out and gets sucked away in the vents. So it's really a highly specialized system. On top of that, we're going to supply them with the N95 masks because I purchased a mask making machine that we're going to have in a few weeks. And like I mentioned, we'll be able to make 30,000 of these masks on a daily basis. So we're hoping to help the whole country with this problem.
Okay, so when things start to get back to normal, it may go in phases. They've been talking about maybe gradually getting things opened up again. In terms of your practice, the dental practice, and the way things used to be, when it comes to scheduling patients, and if somebody's, and we'll get, the next question will be about emergencies in the current situation, yes. But as it goes forward, how are you going to work back towards a normal schedule when it comes to scheduling patients and so on?
I see it kind of ramping up, right? Just like the virus has ramped up and then it's plateaued and hopefully is going to be on the downturn, we're going to have to ramp up our practices, starting out with fewer patients, making sure we're learning the protocols, following the protocols, and then as we get more and more patients in, we'll be able to handle the flow by having more staff members come back to work. Unfortunately, I've had to lay off a number of my staff like other businesses have, but I'm hoping to bring them each back slowly and surely until we ramp up to the position we were hopefully beforehand. We certainly have a large enough facility. We have 22 dental operatories and 4 operating rooms here, so we've got plenty of room to treat all these patients. And our operatories are generous size, so the patients are not right next to each other.
So I'm not sure about other dental practices in the area, but you're open partially for emergencies.
Right.
Somebody's sitting at home now and maybe they have a toothache, but they can live with it. How do you know whether it's an emergency or not?
Well, if somebody's got a toothache, we really don't want them to live with it because generally the pain in the tooth or the toothache is the beginning of something worse, right? So if they have something that's bothering them, they should get in and get it taken care of, and that's what we're here for, because that toothache could, in a day or two, turn into a tooth abscess, and then an infection, and then they could get a bad infection, and then they end up having major problems. So if you have any, I guess your question really is what denotes an emergency, right? The American Dental Association, the governor has asked for dentists to follow the American Dental Association guidelines. And the American Dental Association guidelines for emergency dental care, they call it emergent and urgent dental care. They combine them together, and that's all emergency. So if somebody's got a toothache, a broken tooth, an infection, bleeding gums, abscess gums, had an injury where their tooth got injured, they fell off a bike or they broke a tooth, any kind of facial injury, those are all urgent emergency situations. And then when you get into urgent situations, you're talking about people who might have a partial denture that's digging into their gum, or a broken temporary that's loose and causing pain. Those are urgent care, not necessarily emergency, but urgent. So somebody like you mentioned, somebody's home, they've got a very sensitive tooth that's hurting them, but it's not killing them, that's still considered something that should be treated because it's an urgent situation. It's not an emergency, but it's an urgent thing, and they should get in and get it taken care of. So the Aesthetic Associates Center has remained open throughout this whole process. We are taking all precautions, safety-wise, for myself, for our staff. Myself and Dr. Powers are working, so 2 out of the 5 dentists are working. The other 3 are not working for this time period until it's over.
Okay. I think we've covered almost everything. One thing I didn't ask was, when it comes to the testing, is there some kind of a cost involved at this point? And going forward, how is that going to work as well?
Yeah, so what we're doing is we are charging a fee of $85 for the drive-through. The Quest Laboratory will collect the patient's health insurance information from us and through the app, and they will bill the health insurance for the actual diagnostic portion of it, and the patients can submit to their health insurance to get reimbursed for the $85 fee that we're charging. But we're trying to keep the cost low just to cover our cost of materials and goods and the staff that we have to have here to run the operation. If they are a patient that's having surgery within the next 3 to 5 days, there is no fee for those patients if they're coming to our office for a procedure. It's really for people who want to get tested voluntarily, like we talked about before.
Now, you had mentioned that if they're coming in for surgery, you're going to test for the antibodies.
Yeah.
Is that going to be the same day or
No.
pre?
No, we're going to do the coronavirus testing. If they come back negative from the coronavirus testing, we're still going to test them the day of surgery for the antibody, just to as a double check. But the day of testing for the swab, we're just going to focus on the swabs that day.
Okay. How is this affecting the other half of the building where your brother's practice is?
Well, he's really not working right now because he's a plastic surgeon, and 95% of the work he does is elective, and so the governor has put a hold on elective surgery in Erie County. I noticed yesterday he just opened that up in other counties in the country, in the state, where other counties in the state can perform elective surgeries with limitations, but here in Erie County, he doesn't feel like we've reached that plateau yet and started decreasing. So I think within the next few weeks, hopefully we'll get there, and then they'll be able to open that up. And that's kind of why we want to implement these measures now and make sure we're ready to do this when the time comes to be fully operational.
My thanks to Todd Shatkin for being my guest on This Big Picture. We appreciate how he and so many in the area are stepping up to help out under trying circumstances. Remember to check out Dr. Shatkin's website for information or give a call to 716-43-SMILE. Thanks again for watching The Big Picture, and thanks as always for watching WBBZ-TV.